What are food deserts? According to the U.S. Department of Agriculture, an urban food desert is defined as an area where there is no access to healthy food for more than a mile. For rural areas, that distance can stretch out to 10 miles. Food deserts and food insecurity are national issues within the United States. According to the Economic Research Service of the U.S. Department of Agriculture, approximately 2.3 million people in the United States live more than 1 mile away from a supermarket and do not own a car. Oftentimes, grocery stores are so far away from one's home that fast food is much more desirable than preparing a fresh meal. The price differences across small grocery stores and supermarkets can also affect the desirability of healthy foods. A majority of isolated smaller stores have higher prices than non-isolated stores, and a majority of items at smaller stores are priced higher than at supermarkets. In places such as Cary and Morrisville, where many grocery chains are available, we can compare prices when shopping and find good deals for healthy food. But if there is only one grocery store where you live and fresh food was really expensive, it probably wouldn't be your first choice when compared to cheaper alternatives. According to the Root Cause Coalition, the annual costs of hunger in the United States healthcare system are $130.5 billion. Investing more in nutrition programs would go a long way in addressing obesity and other negative health outcomes faced by low-income Americans. In North Carolina specifically, food insecurity is becoming a very common and worsening issue. North Carolina is actually the 8th hungriest place in the nation, where almost 1 in 4 children in North Carolina faces hunger on a regular basis. About 15.9% of households are food insecure, having to make tough choices about the amount of food they eat as well as the quality of food. Many of these households have to skip meals to make food stretch or are worried that their food will run out. Food insecurity in North Carolina affects children, family, and senior citizens. In North Carolina, food deserts are also affecting the rates of food insecurity. As many parts of North Carolina are rural, access to fresh produce is becoming more and more of an issue, as people are having to travel further and further to reach stores where they can buy healthy food at a reasonable price. In North Carolina, people who live in food deserts such as Greensboro oftentimes can only go shopping for produce once a month because stores are not nearby. This means buying a lot of fresh produce isn't reasonable because even with refrigeration, they will go bad after a few days to a week. One of the hungriest places in the United States is right here in North Carolina, Greensboro, where there isn't only one food desert, but 17 identified food deserts. The easy answer is to simply open supermarkets in food desert zones. However, the high levels of poverty in the area cause private sector investments, such as grocery stores, to turn away from the area. But thankfully to community efforts, hunger rates have been improving in this area. Greensboro and High Point, all under Guilford County and NC, was ranked number 1 for food insecurity in the U.S. until April of 2016. People in the community have been working hard to change the area and have started groups such as Renaissance Cooperative Group, pushing to open grocery stores in their area. After years of planning and searching for funding, the group finally opened their store in 2016 using local food and hiring local workers. Over the past decade, many scientists have been interested in studying food insecurity and effects on the human body. An explosion of research provides more and more evidence that food insecurity is linked with costly chronic diseases and unfavorable medical outcomes, including diabetes, hypertension, obesity, poor mental health, iron deficiency, poor disease management, cost-related medication underuse, and increased healthcare utilization and costs. One estimate of the cost of these and other harms to the nation is more than $167 billion per year. This is because fresh food is way more expensive than prepackaged food or even fast food. When you have limited amounts of income to spend on food and you have to pinch every penny, a fast food meal under $5 is a more logical choice than cooking a fresh meal where almost every ingredient is a couple dollars. In addition, many locations have limited access to grocery stores and fresh foods such as the food deserts we mentioned earlier. When one is facing food insecurity and doesn't have steady access to food, their nutrition suffers, which takes a toll on their bodies. Treating food insecurity early on in one's life is also important, as the nutrition children have during their development period can affect them for the rest of their lives. Nutrition can affect one's growth, and nutrition education can also help people eat healthy for the rest of their lives. A recent study shows adults who had access to food supports as children were 16% less likely to be obese. In North Carolina today, there are many organizations that are picking up the slack left behind by federal programs, such as Interfaith Food Shuttle, Table, Fuel Up, and backpack programs. There are also traditional resources such as food kitchens. However, one of the most effective tools is a program called SNAP. On average, SNAP benefits lifted 175,000 North Carolinians, including 81,000 children, out of poverty from 2011 to 2014. More than 9,600 individual stores in North Carolina accept SNAP. SNAP reaches as many or more rural and small-town residents as metro residents. It is especially important to families with children, and most families receiving SNAP are working or are recently unemployed. The temporary increase in SNAP benefit levels from 2009 American Recovery and Reinvestment Act helped significantly reduce food insecurity and improve the health of young children. Recent studies also link SNAP participation with favorable impacts on metabolic syndrome incidence, body mass index, psychological distress, depression, and economic self-sufficiency. In addition to just helping these individuals, SNAP benefits pumped upwards of $2 billion into the state economy. Much of this economic activity benefits local grocery stores and food retailers. However, the budget for SNAP has been recently cut, causing food insecurity rates to once again rise.
Food deserts are common throughout the world and are becoming more of a problem nowadays. In Africa, cities are experiencing rapid urbanization and are very fragmented. Because of transportation problems, the poor have to spend a chunk of their day traveling in public transits to acquire healthy food. The urban poor spends approximately 50% of their expenses outside of the town that they live in. According to a survey, over 80% of the households in low-income neighborhoods have moderate to severe food insecurity. In Australia, places that have a lesser population had only a few grocery stores with the products sold for very high prices and low quality. To solve this, in 1990, the Department of Health in Western Australia began a 5-year campaign in order to increase access to healthy foods. In France, because of food deserts, the lower-income consumers tend to buy more affordable items instead of nutrient-rich food. In British cities, access to healthy food for low-income households is of great concern as well. Dispersed settlement, affordability, declining suburban areas, smaller rural towns with limited fresh crops, and transportation issues are all factors that contribute to the food deserts in Britain.
Using fertilizer more efficiently could be influential because not all crops need large amounts of nitrogen and phosphorus. Other possible options would be using compost that contain nutrients from food waste. Reusing the organic waste can allow nutrients to be released back into the environment. This is where the concept of reduce, reuse, and recycle evolved. Through this process, the amount of waste can be reduced. Leftover food that is organic can be turned into compost and new nutrients can be created. By targeting food for direct consumption, crops can be used to directly feed people rather than animals. Food distribution is also important because an individual can deliver food to food deserts where they don't receive a substantial amount of food. You can improve the impacts of food deserts in your community by volunteering in a food shelter or food pantry where you can ensure that everyone gets the nutrients they need. Another possible way is by hosting a food drive that collects food and distributes it to food deserts where they do not have access to food resources. Also, donating money rather than food can allow those who need food to purchase what they do need. Promoting awareness of food insecurity helps to increase the access to information in communities that can assist food deserts, or they could become aware of how they can improve and manage their food distribution.
Beyond the individual, there are many ways that we can fight food insecurity policy-wise. 1. We can create jobs, raise wages, increase opportunity, and share prosperity. Restoring value of minimum wage plus higher wage for struggling workers and enforcing wage and hour laws can help people earn more money, which they can then put towards their nutrition. 2. Improve government income support programs for struggling families. 3. Strengthen SNAP. 4. Strengthen child nutrition programs. 5. Target supports to especially vulnerable populations, such as children, people with disabilities, immigrants, seniors, struggling veterans, etc. Food insecurity in these populations is especially high due to long-standing discriminatory treatment and also because these populations tend to suffer inadequate public support programs. 6. Work with states, localities, and nonprofits to expand and improve participation in federal nutrition programs. Whether or not a child is hungry or is receiving good nutrition and is healthy and able to learn should not depend on what state or county the child is born in, or moves to, or where she goes to childcare or which school she attends. 7. Make sure all families have convenient access to reasonably priced, healthy food. Many areas with food insecure families lack decent-sized stores that sell a good variety of food. While community gardens, farmers markets, green carts, and improving the offering of corner stores can help combat this, we need to make grocery stores more accessible to everyone. Last but not least, 8. Build political will. In America today, there is little aggressive political leadership towards fighting hunger. We must make reducing and eliminating American hunger a bipartisan support, because hunger is a human, economic, and fiscal disaster.